Well, with the school year coming to a close end, that inevitably means kids will go from the classroom to daycares and camps.
And that might come along with some health concerns for parents and kids. Provincial wastewater data is detecting an uptick in COVID-19. And Public Health Ontario is also predicting the BA5 subvariant to become the dominant strain in the province. Now, as all of this happens, the majority of the public is waiting for the rollout of a second round of boosters.
So, should parents be concerned? To offer some sound advice and peace of mind, we're joined live now via FaceTime by Dr. Dina, Kulik, pediatrician and founder and director of Kid Crew. Dr. Kulik, good morning to you. So we still get some questions from parents about what activities are safe for them and their kids to resume, especially as the summer allows more options. So should parents exercise caution, or has that ship sailed?
I think we should all still exercise caution. Honestly, I'm still doing that with my own 4 children. I think as much as we can, stay away from people if we're sick, whether we know we have known COVID or any other virus. Testing isn't perfect, of course. So if you're sick, I still think we should be staying home, keeping distance from others when we can do that. I think it's safer to wear masks in settings where you are close together with many other people, particularly indoors. But I think we should enjoy our summer, the few months we have of warmth, and be outside and play like children should and could do now that it's nicer outside and we could be active and playful. Particularly outside, it's much less risky.
Yeah, we hear that from experts like yourself, Dr. Kulik, that being outside is certainly one of the safer places. Here's the thing, though, when you're outside, and I'm dealing with this myself pretty severely right now, allergies. They can be really similar to so many COVID-19 symptoms, the runny nose, the congestion, the sneezing, the coughing, that sort of thing. So how can parents figure out if kids, go to camp or go to daycare during the day or whatever when their kids are dealing with what very similarly look like and sound like COVID?
It's a great question. There's so much overlap. I think if the symptoms suddenly start and go away within a few days, I'm much more, convinced that is going to be a viral infection versus viral, things like allergies will persist for most of the season usually. If your child has never had allergies before and suddenly has, a quick onset of symptoms, and for sure, if there's any fever involved, that is not going to be allergies, that will be a viral illness. And stomach flu symptoms, so vomiting, diarrhea, belly pain, that is more likely to be a virus versus a simple allergy.
Okay, and Dr. Kulik, we're seeing results of a study out of the UK that showed the majority of primary and secondary students have natural antibodies to COVID-19. Can we extrapolate similar situations here, and is that an added layer of comfort?
It is a bit of comfort, but we know that as strains mutate, as they evolve, sometimes they have defense mechanisms against natural immunity or even immunity from previous vaccination. So I wouldn't put all of my eggs in that basket thinking that that's going to provide great protection. It will provide a bit of protection. Adding vaccination to that strategy is going to also bump the protection we have. And again, being cautious about, ideally staying away from people that are sick and staying home if you are sick to decrease the amount of virus in the community.
I suppose, Dr. Kulik, what you're also saying here really is so much of what we've learned and what we've done over the last couple of years, we should be keeping those things in mind. We shouldn't just say we're beyond it now and let's move on.
And for all viruses, I always recommended stay home if you're sick. We don't want your kid or my kid or me to be sick if we can avoid it. And it's hard to detect COVID now, increasingly more challenging. So I think when in doubt, stay home if you're sick, a couple of days, feel better, then go back out there. And that will keep the amount of virus in the community at a lower level, COVID and otherwise.
And Dr. Kulik, looking beyond the summer, when kids resume school in the fall, we have this new BA5 variant kind of creeping up in the province. How concerned are you about that? And do you think that we should be rolling out, vaccines for kids in that younger age group if it does get approved by Health Canada?
I'm hopeful it will be approved by Health Canada. It has been approved by the FDA in the States, and many millions of children have received it in the States. It is a safe and effective vaccine, the Moderna one, Pfizer hopefully coming through the pipeline as well. That will add another layer of support. And those vaccines for the children were made in the Omicron era, so they are a closer match versus the ones that were made previously in the Beta and the Delta era. So yes, it will help boost our immune systems for sure. BA4, BA5, they seem to be more contagious, but they don't seem to cause as much severe illness and death as previous strains. Plus, we have that natural immunity in some, we have vaccinations in some. So I think all those strategies together, public health guidance, staying home if you're sick, masking when possible, vaccination, previous immunity, I think all of that will hopefully keep us all healthier in what seems like is going to be a very challenging viral season.
Yeah, challenging. I like the way you put that. Okay, pediatrician and founder of Kid Crew, Dr. Dina Kulik. We really appreciate when you come on CP24 Breakfast. Thanks for the time and this important conversation this morning.